Chapter 11. Developmental Theories. Understanding growth and development. Growth encompasses the physical changes that occur from the prenatal period through older adulthood, and also demonstrates both advancement and deterioration. Development refers to the biological, cognitive, and socio-emotional changes that begin at conception and continue throughout a lifetime. Development is dynamic and includes progression. However, in some disease processes, development is delayed or regresses. Individuals have unique patterns of growth and development. The ability to progress through each developmental phase influences the overall health of the individual. The success, or failure, experienced within a phase affects the ability to complete subsequent phases. If individuals have repeated developmental failures, inadequacies sometimes result. However, when the individual experiences repeated successes, health is promoted. Traditionally, development focused on childhood, but a comprehensive view of development also includes the changes that occur during the adult years. An understanding of growth and development throughout the lifespan helps in planning questions for health screening and health history, health promotion and maintenance, and health education for patients of all ages. Developmental theories propose ways to account for how and why people grow as they do. The ability to progress through each developmental stage influences the overall health of each individual. Understanding the specific task or need of each developmental stage guides caregivers in planning appropriate individualized care for patients. Developmental theories also provide a framework for examining, describing, and appreciating human behavior. Lastly, they help nurses assess and treat a patient's response to illness. It is important to know that human development is a dynamic and complex process that cannot be explained by only one theory. Biophysical development is how our physical bodies grow and change. Healthcare providers are able to quantify and compare the changes that occur as a newborn infant grows against established norms. Theorists try to explain how the physical body ages and what are the triggers that move the body from the physical characteristics of childhood, through adolescence, to the physical changes of adulthood. Arnold Gesell was one such theorist as well as a psychologist. He proposed that each child's pattern of growth is unique and the patterns are directed by gene activity. His theory proposes that genes direct the sequence of development, but environmental factors also influence development, resulting in developmental changes. For example, poor nutrition, or chronic disease, often affects the growth rate and results in smaller stature, regardless of the genetic blueprint. However, adequate nutrition and the absence of disease cannot result in height beyond that determined by heredity. Today we know that growth in humans is both cephalocaudal and proximodistal. The cephalocaudal pattern describes the sequence in which growth is fastest at the top, meaning from the head and then down, whereas proximodistal growth starts at the center of the body and moves toward the extremities. Psychoanalytical psychosocial theory describes development from personality, cognitive, and behavioral perspectives. Psychoanalytical theory explains development as primarily unconscious and influenced by emotion. Psychoanalytical theorists maintain that these unconscious drives influence development through universal stages experienced by all individuals. Please review Table 11-1, Comparison of Major Developmental Theories, as a supplement to this PowerPoint. Sigmund Freud's psychoanalytical model of personality development states that individuals go through 5 stages of psychosexual development. Each stage of psychosexual development is characterized by sexual pleasure in the mouth, anus, and genitals. He proposed that adult personality is result of conflict resolution between sources of pleasure and reality. Stage 1, oral, encompasses birth to 12 to 18 months of age. Initially, sucking and oral satisfaction are not only vital to life, but also extremely pleasurable in their own rights. Late in this stage, the infant begins to realize that the mother or primary parent is something separate from self. Disruption in the physical or emotional availability of the parent, such as with inadequate bonding or chronic illness, could affect an infant's development. Stage 2, anal, encompasses those aged 12 to 18 months to 3 years. The focus of pleasure changes to the anal zone. Children become increasingly aware of the pleasurable sensations of this body region, with particular interest in the products of their effort. Through the toilet training process, the child allays gratification to meet parental and societal expectations. Stage 3, phallic or Oedipal, encompasses ages 3 to 6 years. The genital organs are the focus of pleasure during this stage. The boy becomes interested in the penis, whereas the girl becomes aware of the absence of the penis, known as penis envy. This is a time of exploration and imagination, as the child fantasizes about the parent of the opposite sex as being the child's first love interest. This is known as the Oedipus, or electrocomplex. By the end of this stage, the child attempts to reduce this conflict by identifying with the parent of the same sex as a way to win recognition and acceptance. Stage 4, latency, focuses on age 6 to 12 years. In this stage, Freud believed that sexual urges from the earlier Oedipal stage are repressed and channeled into productive activities that are socially acceptable. Within the educational and social worlds of the child, there is much to learn and accomplish. Stage 5, genital, occurs from puberty through adulthood. In this final stage, sexual urges reawaken and are directed to an individual outside the family circle. Unresolved prior conflicts also surface during adolescence. Once the individual resolves these conflicts, the individual is then capable of having a mature adult sexual relationship.
Freud believes the ego, and superego regulate behavior. In his theory, the basic instinctual impulses driven to achieve pleasure, is the most primitive part of the personality, and originates in the infant. Therefore, the infant cannot tolerate delay and must have needs met immediately. The ego represents the reality component, mediating conflicts between the environment and the forces of the id. It helps people judge reality accurately, regulate impulses, and make good decisions. Ego is often referred to as one's sense of self. The superego performs regulating, restraining, and prohibiting actions. Often referred to as the conscience, the superego is influenced by the standards of outside social forces such as with a parent or teacher. Critics of Freud state that he based his theory on biological determinants, and ignored influence of culture and experience, and his assumptions are not applicable across different cultures.
Erikson maintained that development occurred throughout the lifespan, and that it focused on psychosocial rather than psychosexual stages. Although Erikson believed that problems in adult life resulted from unsuccessful resolution of earlier stages, his emphasis on family relationships and culture offered a broad lifespan view of development. Erikson's 8 stages of life are: Stage 1, trust versus mistrust. Establishing a basic sense of trust is essential for the development of a healthy personality. The infant's successful resolution of this stage requires a consistent caregiver who is available to meet the infant's needs. From this basic trust in parents, the infant is able to trust in him or herself, in others, and in the world. This formation of trust results in faith and optimism. Stage 2, Autonomy versus sense of shame and doubt. A growing child is more accomplished in some basic self-care activities, including walking, feeding, and toileting. This newfound independence is the result of maturation and imitation. The toddler develops his, or her autonomy, by making choices. Limiting choices and/or enacting harsh punishment leads to feelings of shame and doubt. The toddler who successfully masters this stage achieves self-control and willpower. Stage 3. Initiative versus guilt. Children like to pretend and try out new roles. Also, at this time they are developing their superego, or conscience. Conflicts often occur between the child's desire to explore and the limits placed on the child's behavior. These conflicts sometimes lead to feelings of frustration and guilt. Guilt also occurs if the caregiver's responses are too harsh. Preschoolers are learning to maintain a sense of initiative without imposing on the freedoms of others. Successful resolution of this stage results in direction and purpose. Teaching the child impulse control and cooperative behaviors helps the family avoid the risks of altered growth and development. Preschoolers also frequently engage in animism, a developmental characteristic that makes them treat dolls or stuffed animals as if they have thoughts and feelings. Thus, play therapy is instrumental in helping the child successfully deal with the inherent threats related to hospitalization or chronic illness. Stage 4. Industry versus inferiority. School-age children are eager to apply themselves to learning socially productive skills and tools. They learn to work and play with their peers. They thrive on their accomplishments and praise. Without proper support for learning new skills, or if skills are too difficult, they develop a sense of inadequacy and inferiority. Children at this age need to be able to experience real achievement to develop a sense of competency. Erikson believed that the adult's attitudes toward work are traced to successful achievement of this task. During hospitalization, it is important for the school-age child to understand the routines and participate as actively as possible in the treatment. Stage 5. Identity versus role confusion. Dramatic physiological changes associated with sexual maturation mark this stage. There is a marked preoccupation with appearance and body image. This stage, in which identity development begins with the goal of achieving some perspective or direction, answers the question, "Who am I?" Acquiring a sense of identity is essential for making adult decisions, such as with the choice of a vocation or marriage partner. There are new social demands, opportunities, and conflicts that relate to the emergent identity and separation from family. Erikson held that successful mastery of this stage resulted in devotion and fidelity to others, and to their own ideals. Elkind identified a notion of perceived invulnerability in adolescence that can contribute to risk-taking behaviors. Stage 6. Intimacy versus isolation. Young adults, having developed a sense of identity, deepen their capacity to love others and care for them. Erikson portrayed intimacy as finding the self, and then losing it in another. If the young adult is not able to establish companionship and intimacy, isolation results because the young adult fears rejection and disappointment. Stage 7. Generativity versus self-absorption and stagnation. Following the development of an intimate relationship, the adult focuses on supporting future generations. The ability to expand one's personal and social involvement is critical to this stage of development. Middle-aged adults achieve success in this stage by contributing to future generations through parenthood, teaching, mentoring, and community involvement. Achieving generativity results in caring for others as a basic strength. Inability to play a role in the development of the next generation results in stagnation. Stage 8. Integrity versus despair. Older adults often engage in a retrospective appraisal of their lives. They interpret their lives as a meaningful whole, or experience regret because of goals not achieved. Because the aging process creates physical and social losses, Some adults also suffer loss of status and function. These external struggles are met with internal struggles, such as the search for meaning in life. Meeting these challenges creates the potential for growth and the basic strength of wisdom. Case study: Ahmed is pursuing a career in nursing because he loves children and wishes to become a pediatric nurse. Before attending nursing school, Ahmed volunteered at a large metropolitan children's hospital. Ahmed is in his first semester of nursing school and is learning about Freud's developmental theories. In what order would he place the stages of psychosocial development as determined in Freud's psychoanalytical model of personality development? Answer: the correct order of the stages of psychosocial development in Freud's psychoanalytical model of personality development is as follows: Stage 1, oral; Stage 2, anal; Stage 3, phallic or Oedipal; Stage 4, latency; and Stage 5, genital. Case study continued. Ahmed is studying Gesell's theory of development with a friend. His friend says, according to Gesell's theory of development, each child's pattern of growth is a result of environmental influences. Is this statement true or false? This statement is false. According to Gesell's theory of development, each child's pattern of growth is directed by gene activity, not by environmental factors. Chess and Thomas identify three basic childhood temperaments. 1. The easy child, who is easygoing and even-tempered. They are regular and predictable in his or her habits, and are open and adaptable to change. They tend to display a mild to moderately intense mood that is typically positive. 2. The difficult child is highly active, irritable, and irregular in habits. Negative withdrawal toward others is typical, and the child requires a more structured environment. They adapt slowly to new routines, people, or situations. Mood expressions are usually intense and primarily negative. And 3. The slow-to-warm-up child typically reacts negatively, and with mild intensity to new stimuli. They adapt slowly with repeated contact, and less pressured, and then respond with mild, but passive resistance to novelty or changes in routine. Knowledge of temperament and how it impacts the parent-child relationship is critical when providing anticipatory guidance for parents. With the birth of a second child, most parents find that the strategies that worked well with the first child no longer work at all. The nurse individualizes counseling to greatly improve the quality of interactions between parents and children. Perspectives on adult development. Aging changes come more slowly as people continue to develop new abilities to adapt to shifting environments. Two such theories are the stage crisis theory and the lifespan approach. The stage crisis theory was developed by Robert Havinghurst. He conducted extensive research and developed a theory of human development based on developmental tasks. Havinghurst believed that successful resolution of the developmental task was essential to successful progression throughout life. He identified 6 stages and 6 to-10 developmental tasks for each stage. Stage 1, infancy and early childhood, birth to age 6 years. Stage 2, middle childhood, age 6 to 12 years. Stage 3, adolescence, age 13 to 18 years. Stage 4, early adulthood, age 19 to 30 years. Stage 5, middle adulthood, age 30 to 60 years. And Stage 6, late adulthood, 60 years and older. Havinghurst's theory incorporates 3 primary sources for developmental tasks. 1. Tasks that surface because of physical maturation. 2. Tasks that evolve from personal values, and 3. Tasks that are a result of pressure from society. The lifespan approach considers the following. 1. An individual's personal circumstances, such as health and family support. 2. How a person views and adjusts to changes. And 3. The current social and historical context in which an individual is living. The lifespan perspective suggests that understanding adult development requires multiple viewpoints. Paul Baltus, a lifespan development expert, viewed lifespan development as lifelong, multidimensional, multidirectional, plastic, multidisciplinary, and contextual. In Baltus' view, development is constructed through an interaction of biological, sociocultural, and individual factors. Current research on successful aging is much more consistent with a lifespan approach that emphasizes age-related goals that are relationship and socially oriented to support continued well-being. Cognitive developmental theories examine how people learn to think and make sense of their world. They focus on rational thinking processes, including changes in how children, adolescents, and adults perform intellectual operations. Jean Piaget was a Swiss biologist and philosopher interested in the development of children's intellectual organization. In other words, how they think, reason, and perceive their world. Piaget believed that individuals move from one stage to another seeking cognitive equilibrium or a state of mental balance. Play is important to a child's development. Piaget was later challenged, as we now know that many adults may not become formal operational thinkers and remain at the concrete stage, and others have cognitive development that goes beyond the stages that Piaget proposed. Assessment of cognitive ability becomes critical as the nurse engages in healthcare teaching for patients and families. Period 1 is sensory motor, birth to 2 years. During the phase, infants develop a schema, or action pattern, for dealing with the environment, which are self-initiated. Successful achievement leads to greater exploration. The child learns object permanence, which is an understanding that objects continue to exist even when they cannot be seen, heard, or touched. This is one of the child's most important accomplishments. Period 2 is pre-operational, age 2 to 7 years. Children learn to think with the use of symbols and mental images. They exhibit egocentrism, in that they see objects and people from only one point of view, their own, and believe that everyone experiences the world exactly as they do. Early in this stage, children demonstrate animism in which they personify objects. They believe that inanimate objects have lifelike thought, wishes, and feelings. Their thinking is influenced greatly by fantasy and magical thinking. Play becomes a primary means by which they foster their cognitive development and learn about the world, and also is a nursing intervention that helps the child work through invasive and intrusive procedures that may occur during hospitalization. Play also helps the ill child progress developmentally. Period 3. Concrete operations. Age 7 to 11 years. Children now are able to perform mental operations, and can coordinate two concrete perspectives in social and scientific thinking, so they are able to appreciate the difference between their perspective and that of a friend. Children can now mentally picture a series of steps and reverse the steps to get back to the starting point. The ability to mentally classify objects according to their quantitative dimensions, known as seriation, is achieved. They are able to correctly order or sort objects by length, weight, or other characteristics. Another major accomplishment of this stage is conservation, or the ability to see objects or quantities as remaining the same despite a change in their physical appearance. Period 4. Formal operations. Age 11 years to adulthood. There is a transition from concrete to formal operational thinking. Egocentricity leads adolescents to demonstrate feelings and behaviors characterized by self-consciousness. a belief that their actions and appearance are constantly being scrutinized, that their thoughts and feelings are unique, and that they are invulnerable. These feelings of invulnerability frequently led to risk-taking behaviors, especially in early adolescence. As adolescents share experiences with peers, they learn that many of their thoughts and feelings are shared by almost everyone, helping them to know that they are not so different. As they mature, their thinking moves to abstract and theoretical subjects. They have the capacity to reason with respect to possibilities. For Piaget, this stage marked the end of cognitive development. Developmentalists proposed a fifth stage of cognitive development termed post-formal thought. Within this stage, adults demonstrate the ability to recognize that answers vary from situation to situation and that solutions need to be sensible. Adults do not always arrive at one answer to a problem, but frequently accept several possible solutions. As adolescents were able to move from a position of accepting only one answer to realizing that alternative explanations could be right, depending on one's perspective, a significant cognitive change occurred. Please review Box 11-1, Evidence-Based Practice Applying Developmental Theory to Care of Infants, as a supplement to this PowerPoint. Case study continued. Ahmad is learning that psychoanalytical theorists varied greatly in their perceptions related to development. One of them believed that development occurred throughout the lifespan and focused on psychosocial stages, but Ahmad can't remember if it was Piaget, Freud, Erikson, or Chess. The answer is Erikson. Erikson believed that development occurred throughout the lifespan and that it focused on psychosocial stages rather than psychosexual stages. Moral developmental theory encompasses both interpersonal and intrapersonal dimensions as it governs how we interact with others. Lawrence Kohlberg expanded upon Piaget's work. His moral developmental theory attempts to define how moral reasoning matures for an individual. It refers to changes in a person's thoughts, emotions, and behaviors that influence the perception of right or wrong. Kohlberg proposed that moral reasoning develops in 6 stages, in 3 levels. Level 1 is the pre-moral level, in which cognitive thinking is limited, and the individual's thinking is primarily egocentric. At this stage, thinking is mostly based on likes and pleasures. This stage progresses toward having punishment guide behavior. Nurses need to be aware of this egocentric thinking and must reinforce that the child does not become ill because of wrongdoing. Stage 1 is avoiding punishment or the unquestioning deference to authority as characteristic motivation to behave. Physical consequences guide right and wrong choices. If the child is caught, it must be wrong. If the child escapes, it must be right. Stage 2. The child recognizes that there is more than one right view. The decision to do something morally right is based on satisfying one's own needs and occasionally the needs of others. The child perceives punishment not as proof of being wrong, as in stage 1, but as something that one wants to avoid. Level 2. Moral decision-making at this level moves from, "What's in it for me?" to "How will it affect my relationships with others?" Emphasis now is on social rules and a community-centered approach. Nurses observe this when family members make end-of-life decisions for their loved ones. Grief support involves an understanding of the level of moral decision-making of each family member. Stage 3. The individual wants to win approval and maintain the expectations of one's immediate group. Being good is important and defined as having positive motives, showing concern for others, and keeping mutual relationships through trust, loyalty, respect, and gratitude. One earns approval by being nice, and Stage 4. Individuals expand their focus from a relationship with others to societal concerns. Moral decisions take into account societal perspectives. Right behavior is doing one's duty, showing respect for authority, and maintaining the social order. Level 3. Individuals move away from moral decisions based on authority, or conformity to groups, to define their own moral values and principles. Individuals at this stage start to look at what an ideal society would be like. Moral principles and ideals come into prominence. Stage 5. An individual follows the societal law but recognizes the possibility of changing the law to improve society. The individual also recognizes that different social groups have different values but believes that all rational people would agree on basic rights, such as liberty and life. Individuals at this stage make more of an independent effort to determine what society should value rather than what society as a group would value, as would occur in Stage 4. The U.S. Constitution is based on this morality. Stage 6 defines right by the decision of conscience in accord with self-chosen ethical principles. These principles are abstract, like the Golden Rule, and appeal to logical comprehensiveness, universality, and consistency. Kohlberg has his critics because his studies were done on males raised with Western philosophical traditions. Research showed that those raised in Eastern traditions did not get above stages 3 or 4. Indicating that these subjects have not reached higher levels of moral development, which is untrue. Carol Gilligan criticized Kohlberg for his gender bias. She believes that he developed his theory on the basis of a justice perspective that focused on the rights of individuals. In contrast, Gilligan's research looked at moral development from a care perspective that viewed people in their interpersonal communications, relationships, and concern for others. Moral reasoning in nursing practice. Nurses need to identify their own moral reasoning. Nurses need to recognize the level of moral reasoning used by other healthcare team members. Nurses need to separate their own beliefs when helping patients with their moral decision-making process. Recognizing your own moral developmental level is essential in separating your beliefs from others when helping patients with their moral decision-making process. Ethical decisions should be examined through the ethical principles of autonomy, beneficence, non-maleficence, and justice. Time for a quick quiz. According to Kohlberg, moral development is a component of psychosocial development. Moral development depends on the child's ability to integrate a. Modeling of others, b. Faith and optimism, c. Self-control and independence, or d. Decisions of right and wrong. The answer is d. Kohlberg believed that moral development was dependent on the child's ability to integrate decisions of rights and wrong. From the diverse set of theories included in this chapter, the complexity of human development is evident. Today's nurse needs to be knowledgeable about several theoretical perspectives when working with patients. Developmental theories help nurses to use critical thinking skills. Your assessment of a patient requires a thorough analysis and interpretation of data to form accurate conclusions about your patient's developmental needs. The theories serve as important guidelines for understanding important human processes that allow nurses to begin to predict human responses and to recognize deviations from the norm. Examples of nursing diagnoses applicable to patients with developmental problems include the following: risk for delayed development, delayed growth and development, and risk for disproportionate growth.